A glimmer of hope in the face of daunting challenges. Good morning, everyone. I'm Akush Lapinder, and this is your morning edition. A dose of optimism, yet caution from the Prime Minister as the Bahamas continues its fight against the COVID-19 pandemic. 49 confirmed cases and 8 deaths later. Our Altaviz Munnings has more from the Prime Minister's national address in this report.
Our physical distancing measures, curfews, and lockdowns are having an effect. But we still have a long way to go.
1 month after the Bahamas reported its first positive case of the COVID-19 virus, Prime Minister the Most Honorable Dr. Hubert Minnis is optimistic that the Bahamas is making progress in the fight against the pandemic, but he admits that now is not the time to let down our guard. The Prime Minister appealed to private sector doctors to join the front line during his national address Easter Monday, as he maintains the Bahamas needs every health professional available to fight this grave threat. The Prime Minister pledged that he too will join the fight if he has to, as they all took a solemn oath to protect lives. While confirming 2 additional COVID-19 cases in New Providence that now pushes the total count to 49, Prime Minister Minnis outlined the conditions that encompassed the 8 individuals who have died from the virus.
The patients who have succumbed to COVID-19 were older in age and had significant comorbidities or conditions that are known to cause a poor outcome in COVID-19. These conditions include essential hypertension, asthma, obesity, and malignancy or cancer. These underlying conditions led to dire outcomes as well as to the severity of their infections and pneumonias. Several of these patients were intubated and supported with critical care, but were unable to recover. There are additional factors related to those who are being tested with the SARS-CoV coronavirus 2, the virus that causes COVID-19 in the Bahamas to date.
The Prime Minister also announced that government's alphabetical supermarket schedule, which began on April 6th, has been suspended from April 14th through 17th and will resume on Monday, April 20th. He confirmed that grocery stores in New Providence will open from 6 a.m. to 7 p.m. and only seniors and the disabled will be able to shop in the grocery stores from 6 a.m. to 8 a.m. The nation's leader further revealed that effective immediately on Saturdays during the weekend lockdowns, grocery stores will be allowed to operate from 6 a.m. to 6 p.m. and pharmacies will be opened until 3 p.m. only for essential workers.
There is enough food in our Bahamas for everyone. There is no need for panic buying. There is enough food. I also wish to remind you that because of expiration dates on food, to be careful about stockpiling food. You do not wish to make yourself and your family sick by consuming food that has expired. I encourage store owners to design a system for their stores that works best. For example, in some stores on New Providence and Grand Bahama, a ticketing system appears to be working well. This is a process other stores may wish to adopt. If you do not need to go to the food store, that is tomorrow, please consider waiting for another day. This will help you to avoid lines and to protect your health and the health of others. There is no perfect system during times such as these, but let us all work together to design the best system possible.
Altaviz Munnings, ZNS Network News.
Now, the Prime Minister's COVID-19 update also leading to the announcement of a food security task force being appointed. The idea is to ensure every Bahamian and resident who needs food gets it.
The task force We'll also make recommendations to increase food production in the Bahamas, including through BAMSI, farmers markets, backyard and community gardens, and other ways of producing and distributing food in the short, medium, and long term. I will have more to say about this domestic food production in the week ahead. Such production will play a significant role in stimulating our domestic economy. Because of our high rate of non-communicable diseases, such as diabetes and hypertension, and the very high level of obesity in the country, we will aggressively promote healthier eating, nutrition, and physical activity. The current range of health problems in our country and the resulting impact on immune systems is playing a significant and determining role in how our bodies can deal with the effect of this COVID-19 virus.
Still on the issue of food and food supplies, governmental and non-governmental agencies, along with private sector companies, have banded in this regard.
Through their combined efforts, fresh produce, cooked meals, grocery packets, and other food supplies have been delivered directly to those in need in Abaco, Grand Bahama, Eleuthera, and New Providence. In the last 7 days, the Bahamas Feeding Network distributed $40,000 in food vouchers and between $10,000 to $15,000 in food parcels. Hands for Hunger has distributed 50,000 pounds of donated food, $5,000 in non-perishables, and are budgeting an additional $20,000 for food vouchers. We encourage others to donate food. The Food Security Task Force will indicate how such donations can be made.